As men enter their senior years, the topic of masturbation and its effects on prostate health becomes increasingly complex and concerning. While society often promotes the idea that any sexual activity is beneficial, the reality for seniors is far more nuanced and potentially problematic. What many men over 50 don't realize is that masturbation can actually cause significant harm to an already vulnerable prostate gland, leading to complications that can drastically affect quality of life. The prostate gland in seniors is not the same resilient organ it was in younger years. After decades of hormonal changes, cellular damage, and natural aging processes, the prostate becomes increasingly susceptible to inflammation, infection, and mechanical trauma. When we examine the scientific evidence objectively, a troubling pattern emerges that suggests masturbation may be doing more harm than good for the aging male population. Understanding these risks is crucial because the consequences of prostate damage in seniors can be severe and long-lasting. Unlike younger men who can recover quickly from minor prostate irritation, seniors often face prolonged healing times, increased infection risks, and potential permanent damage to urinary and sexual function. The aging prostate's vulnerability. The senior prostate is fundamentally different from its younger counterpart, making it particularly susceptible to damage from masturbation. As men age, the prostate undergoes significant structural changes that compromise its ability to handle the mechanical stress and inflammation associated with frequent ejaculation. The prostate tissue becomes less elastic and more prone to microtears during the intense muscular contractions that occur during ejaculation. These microscopic injuries may seem insignificant, but in the context of an aging immune system and slower cellular repair processes, they can become gateways for bacterial infections and chronic inflammation. Additionally, the blood vessels supplying the prostate become less efficient with age, reducing the organ's ability to deliver nutrients and remove waste products. This compromised circulation means that any inflammation or damage caused by masturbation takes longer to heal and may result in permanent scarring or dysfunction. The hormonal environment in seniors also creates conditions that make prostate damage more likely and more severe. Declining testosterone levels combined with relatively stable estrogen levels create an imbalance that promotes prostate enlargement and increases inflammation. Masturbation can exacerbate these hormonal imbalances, leading to accelerated prostate problems. The hidden epidemic. One of the most serious consequences of frequent masturbation in seniors is the development of chronic prostatitis, a condition that affects millions of older men, but is often misdiagnosed or ignored. This inflammatory condition can cause debilitating pain, urinary dysfunction, and sexual problems that persist for months or even years. The repetitive trauma associated with masturbation can trigger an inflammatory cascade within the prostate tissue. In seniors whose immune systems are already compromised, this inflammation can become chronic and self-perpetuating. The prostate becomes trapped in a cycle of inflammation and attempted healing, never fully recovering from the damage. Men with chronic prostatitis often experience a constellation of symptoms that dramatically impact their quality of life. Pelvic pain becomes a constant companion, making sitting, walking, or even lying down uncomfortable. Urination becomes painful and frequent, disrupting sleep and daily activities. Sexual function deteriorates as the inflamed prostate makes ejaculation painful or impossible. What makes chronic prostatitis particularly insidious is that it often develops gradually. Many seniors dismiss early symptoms as normal aging, continuing to masturbate and unknowingly worsening their condition. By the time they seek medical attention, the inflammation has become entrenched and much more difficult to treat. Urinary complications and incontinence. The relationship between masturbation and urinary problems in seniors is complex and deeply concerning. The forceful contractions during ejaculation can damage the delicate muscles and nerves that control urinary function, leading to incontinence, urgency, and incomplete bladder emptying. The prostate's position surrounding the urethra means that any inflammation or swelling directly impacts urinary flow. Repeated episodes of prostate irritation from masturbation can cause cumulative damage to the urethral sphincter and surrounding tissues, resulting in progressive loss of urinary control. Many seniors report that their urinary symptoms worsen after masturbation with increased frequency, urgency, and difficulty starting urination. This is particularly problematic for men who already struggle with benign prostatic hyperplasia, BPH, as masturbation can exacerbate the mechanical obstruction and inflammation associated with this condition. The psychological impact of urinary incontinence cannot be overstated. Seniors who develop incontinence problems related to masturbation often experience shame, social isolation, and depression. The fear of embarrassing accidents leads many to restrict their activities and withdraw from social situations, creating a downward spiral of physical and mental health decline. Increased infection risk. The aging immune system's reduced ability to fight infections makes seniors particularly vulnerable to prostate infections following masturbation. The combination of mechanical trauma, reduced circulation, and compromised immune function creates an ideal environment for bacterial growth and infection. Bacterial prostatitis is a serious condition that can cause severe pain, fever, and urinary obstruction. In seniors, these infections can be particularly dangerous because they may not mount a typical immune response, allowing infections to spread or become chronic before they're recognized and treated. The risk of infection is compounded by age-related changes in hygiene practices and genital sensitivity. Many seniors have reduced sensation in their genital area, making them less likely to notice early signs of infection or irritation. Additionally, mobility issues or cognitive changes may affect their ability to maintain proper hygiene, increasing the risk of introducing harmful bacteria during masturbation. Chronic or recurrent prostate infections can lead to serious complications including abscess formation, sepsis, and permanent damage to prostate tissue. The repeated use of antibiotics to treat these infections can also lead to antibiotic resistance, making future infections more difficult to treat. Cardiovascular stress and complications. The cardiovascular demands of masturbation pose significant risk for seniors, particularly those with existing heart conditions or hypertension. The intense physical and emotional arousal associated with masturbation causes dramatic increases in heart rate, blood pressure, and cardiac output that can be dangerous for aging cardiovascular systems. During sexual arousal and ejaculation, blood pressure can increase by 40 to 50 millimeters of mercury, placing enormous stress on already compromised blood vessels. For seniors with atherosclerosis, hypertension, or heart disease, these sudden pressure spikes can trigger heart attacks, strokes, or dangerous arrhythmias. The prostate itself requires significant blood flow during sexual arousal, diverting blood from other vital organs. In seniors with poor circulation or multiple cardiovascular risk factors, this redistribution of blood flow can compromise circulation to the heart, brain, or other critical organs. Recovery from the cardiovascular stress of masturbation also takes longer in seniors. While younger men quickly return to baseline heart rate and blood pressure, seniors may experience prolonged elevation of these parameters, increasing their risk of cardiovascular complications hours after the sexual activity has ended. Hormonal disruption and imbalance. Masturbation can significantly disrupt the delicate hormonal balance that seniors struggle to maintain. The aging male endocrine system is already under stress from declining testosterone production, insulin resistance, and other age-related hormonal changes. Adding the hormonal chaos of frequent ejaculation can tip this precarious balance toward dysfunction. The immediate aftermath of ejaculation involves a complex cascade of hormonal changes, including spikes in prolactin, cortisol, and other stress hormones. In seniors whose hormone clearing mechanisms are less efficient, these fluctuations can persist for days, creating chronic hormonal imbalances that affect mood, energy, sleep, and immune function. Chronic elevation of stress hormones like cortisol can suppress immune function, increase inflammation throughout the body, and accelerate the aging process. This creates a vicious cycle where masturbation-induced hormonal changes make the prostate more vulnerable to further damage and dysfunction. The disruption of the hypothalamic-pituitary-gonadal axis can also lead to further decreases in testosterone production, worsening the age-related decline in this crucial hormone. Low testosterone in seniors is associated with increased risk of prostate cancer, cardiovascular disease, osteoporosis, and cognitive decline. Psychological and cognitive impact. The psychological consequences of masturbation in seniors are often overlooked, but can be devastating. Many older men struggle with guilt, shame, and anxiety related to their sexual behavior, particularly if they were raised in more conservative eras when masturbation was heavily stigmatized. This psychological distress can manifest as depression, anxiety, and social withdrawal, all of which have direct negative impacts on immune function and overall health. Chronic stress and depression increase inflammation throughout the body, including in the prostate, creating a cycle where psychological distress worsens physical symptoms. Cognitive function can also be impacted by the hormonal and psychological effects of masturbation. The post-ejaculatory period is associated with decreased cognitive performance, reduced motivation, and emotional lability. In seniors who may already be experiencing age-related cognitive decline, these effects can be particularly pronounced and concerning. Sleep disturbances are another common consequence of masturbation in seniors. The hormonal changes in physical arousal can disrupt normal sleep patterns, leading to insomnia, frequent awakening, and non-restorative sleep. Poor sleep quality has cascading effects on immune function, mood, and overall health. Medication interactions and complications. Many seniors take multiple medications that can interact dangerously with the physiological changes induced by masturbation. Blood pressure medications, heart medications, and prostate medications can all be affected by the cardiovascular and hormonal changes that occur during sexual activity. The vasodilation and blood pressure changes associated with masturbation can potentiate the effects of antihypertensive medications, potentially causing dangerous drops in blood pressure that can lead to falls, strokes, or heart attacks. Similarly, the interaction between sexual arousal and cardiac medications can cause unpredictable and potentially fatal arrhythmias. Prostate medications, particularly alpha blockers used to treat BPH, can interact with the muscular contractions and blood flow changes during masturbation, potentially causing retrograde ejaculation, painful ejaculation, or urinary retention. These complications can be particularly distressing for seniors who are already struggling with urinary and sexual dysfunction. Social and relationship consequences. The physical and psychological effects of masturbation-related prostate problems can have devastating impacts on seniors' social lives and relationships. Chronic pain, urinary incontinence, and sexual dysfunction can strain marriages and partnerships, leading to relationship breakdown and social isolation. Many seniors report that their partners become frustrated or unsympathetic when confronted with the consequences of masturbation-related prostate problems. The shame and embarrassment associated with these issues often prevent men from seeking help or discussing their problems openly, leading to further isolation and deteriorating relationships. The financial burden of treating masturbation-related prostate problems can also strain relationships and family finances. Chronic prostatitis, recurrent infections, and urinary incontinence often require ongoing medical treatment, medications, and sometimes surgical interventions that can be expensive and are not always covered by insurance. Long-term consequences and irreversible damage. Perhaps most concerning is the potential for irreversible damage to the prostate and surrounding structures from chronic masturbation in seniors. The cumulative effects of repeated inflammation, infection, and mechanical trauma can lead to permanent scarring, nerve damage, and functional impairment. Chronic inflammation can cause fibrosis of prostate tissue, leading to permanent enlargement and obstruction of urinary flow. This scarring is irreversible and may eventually require surgical intervention to restore normal function. The risks associated with prostate surgery in seniors are significant and include incontinence, erectile dysfunction, and life-threatening complications. Nerve damage from repeated trauma can result in permanent loss of sensation, erectile dysfunction, and urinary incontinence. Unlike younger men who may recover from minor nerve injuries, seniors often experience permanent functional deficits that dramatically impact their quality of life. The psychological consequences of these physical changes can also become entrenched and permanent. Depression, anxiety, and social withdrawal related to masturbation-induced prostate problems can persist even after medical treatment, creating lasting impacts on mental health and well-being. The cascade effect on overall health. The problems associated with masturbation in seniors don't exist in isolation, but create a cascade of health issues that can affect multiple body systems. Chronic prostate inflammation contributes to systemic inflammation, which accelerates aging and increases the risk of cardiovascular disease, diabetes, and cancer. Sleep disturbances related to prostate problems can lead to immune suppression, cognitive decline, and increased risk of falls and accidents. The chronic pain associated with prostatitis can lead to reduced physical activity, muscle weakness, and further health deterioration. The social isolation and relationship problems that often result from masturbation-related prostate issues can have profound impacts on mental health and longevity. Social connection is crucial for healthy aging, and the shame and embarrassment associated with these problems can lead to dangerous levels of isolation. Conclusion. The evidence is clear that masturbation poses significant risk to prostate health in seniors. The combination of age-related vulnerability, compromised immune function, and the mechanical and hormonal stresses of masturbation creates a perfect storm for prostate damage and dysfunction. Unlike younger men who can engage in masturbation with minimal consequences, seniors must carefully consider the potential risks and long-term implications of this behavior. The temporary pleasure of masturbation must be weighed against the very real possibility of chronic pain, urinary dysfunction, relationship problems, and irreversible damage to health and quality of life. The path forward for seniors concerned about prostate health involves honest acknowledgement of these risks and careful consideration of lifestyle modifications that prioritize long-term health over short-term gratification. This may mean reducing or eliminating masturbation, seeking professional help for compulsive behaviors, and focusing on other aspects of health and wellness that can improve quality of life without the associated risks. Understanding these risks empowers seniors to make informed decisions about their sexual health and to seek appropriate medical care when problems arise. The goal is not to shame or stigmatize, but to provide honest, evidence-based information that can help seniors navigate this complex aspect of aging with awareness and caution. This information is for educational purposes only and should not replace professional medical advice. Always consult with your healthcare provider about concerns regarding prostate health or sexual function.